Physical therapy is focused on two big problems: helping people have less pain and helping them move better. It's important because research is showing how physical therapy works to improve both these problems. And research is mounting that better short and long-term recovery is possible by working with an expert like a physical therapist. Hi, I'm Heather, and I've been working as a doctor of physical therapy for more than 10 years and helped many people with movement problems like injuries or chronic pain. My goal is always to share as much information as I can to make sure you can take control of your body's health. I started this YouTube channel to help more people like you to know how and when PT can help. Please like, subscribe, and hit the bell for notifications. Moving around is something that can be really easy to take for granted until we can't anymore. With or without physical therapy, Ben's ankle is going to go through the body's natural healing process, and he may even get back to his normal running without any issues. But there can be risks that he's actually going to set himself back or even do lasting damage by not understanding what his ankle needs to recover. When we check the research, articles like this one from 2016 on recovery after an ankle sprain highlight physical therapy as one of the most influential factors in making a full recovery, and highlight the fact that getting help sooner is better. Even right after an injury happens, physical therapists can help. As soon as Ben sprained his ankle, his body's automatic responses kicked in. Nerves sent signals to his brain, and a rush of infection fighters flooded into his ankle to start the repair process. With all that pain and swelling, though, it hurt too much for Ben to walk or even stand on his foot. Across the US, physical therapy is moving more and more into the role of first contact healthcare for musculoskeletal injuries like sprains. Some are even offering free injury screens to help tell if an injury is minor or needs more medical attention. For example, if Ben doesn't meet any of the signs in the Ottawa ankle prediction rules during his PT screening, he has a less than 1% chance of having a fractured ankle. This information could help save him a trip to the emergency room or an x-ray he doesn't need. PTs also understand how to protect the body after an injury and can help teach Ben techniques like how much weight to keep off his ankle with his crutches and whether he needs a brace to support it. Without advice from a therapist, Ben might try to rest and stay off his ankle, or try to push through and walk on it like normal. Either option might impact his recovery by either slowing his healing with immobility or causing more injury with overuse. A few days after his injury, Ben could tell his swelling was starting to shrink, and he could move his ankle with less pain. As the days went by, he was having an easier time walking with his crutches. But after a couple of weeks, his back was starting to hurt when he was walking from the parking lot to his desk at work. During the first 30 days after his injury, Ben's body is doing most of its muscle repair and creating scar tissue to support his damaged ankle. Scar tissue is an important part of the healing process, and most of the time provides stability, but sometimes it can cause restrictions instead. Because this is a crucial time in the healing process, physical therapy can be particularly helpful at this stage. But even if Ben waits until now to start working with a physical therapist, evidence again suggests it can reduce long-term pain and even end up cheaper than waiting longer to start therapy. Two studies, one with people having low back pain and another with patellofemoral knee pain, both found the benefits to starting PT in the first 30 days after an injury, doctor's visit, or emergency visit for their pain. They needed less imaging and less prescription pain management, like opioids, which reduced their costs. Both studies also showed a lower chance of long-term problems like recurring pain or a need for surgery. At PT, the therapist's hands-on treatments and gentle strengthening guide Ben's muscle and scar tissue healing so that he has all the movement he needs to walk and run. He can also get help managing his swelling, which is still coming and going. Protecting an injured ankle also takes a lot of effort by the other parts of the body, and those parts need to be supported as well. A therapist will be able to give him advice and exercises to keep his whole body healthy while his ankle heals. On his own, Ben's risks might again be delaying his healing or developing long-term problems. If his scar tissue is too restrictive, he might have trouble getting back to running, or need more medical procedures to help fix it. Or he might develop a chronic pain in his back that actually outlasts his ankle injury. Checking in with a PT could be a great way to reduce the risks in all of these areas. Around 5 weeks after his injury, Ben could almost move his ankle in all directions without pain and was barely using his crutches anymore. His ankle was still stiff though, and would get sore after walking or sitting a while. Anytime it was stiff, he noticed he had started to limp until it loosened up. During this healing phase, Ben's body is remodeling his scar tissue to meet the demands of his movement, which is why it's important to make sure all of his movements are in patterns that he wants to reinforce, like not limping. PT, even at this stage, is about helping you move better in the long term and meeting the goals that are most important to you. After attending PT, research shows that many people find they get more than just a medical visit. they get a highly skilled new resource. Their therapist becomes a team member who listens to them and gives them tools and resources to create lasting improvements. There are also ways to help make sure your PT experience gets the results you want. At the top of the list is advocating for yourself by talking to your doctor or a PT as soon as possible about how therapy might help you. Sometimes it's as simple as giving a PT a call, and it could be a good chance to avoid some of the risks we've talked about today. Another great way to maximize your PT experience is with lots of communication with your therapist. Be honest and thorough, and make sure to talk about your symptoms and your goals. The whole profession of physical therapy is built on the knowledge of how bones, muscles, joints, and nerves work together in the body. So the more information we have to work with, the better. At physical therapy, Ben's PTA teaches him when to use his crutches to avoid limping and exercises to keep his ankle from getting stiff at work. His therapist also knows he wants to get back to running. So, on top of strengthening his ankle, his therapies include balance and strength exercises for his hip and knee, and techniques on safely returning to running. On his own, Ben could probably find exercises to strengthen his ankle online or by going to the gym. And he could definitely make the decision to start walking more without his crutches. It's totally understandable that as he starts to feel better, he might even be excited to push himself to get back to running. But if his ankle is pushed too much before its strength returns, he might be risking a re-injury by overusing it. A big risk is that if it keeps getting re-injured, his ankle might actually need surgery to keep it stable. And while compensations like limping can be normal during healing, once a new pattern is set and scar tissue is built to reinforce it, getting out of that pattern can be tough without extra help. And those compensation patterns can get reinforced during a high-demand activity like running, which could lead to another injury or damage that again might eventually need surgery. The same idea also applies for aches and pains caused by conditions like muscle spasms or arthritis. This study around knee osteoarthritis showed exercise and hands-on physical therapy for 1 month significantly improved both participants' pain and ability to walk. The results showed lasting improvement during the year the group was followed and less likelihood of a knee replacement after 1 year in those same people. Other research, highlighted by the American Physical Therapy Association, demonstrates physical therapy can be as good as surgery for some conditions, like meniscus tears and knee osteoarthritis, rotator cuff tears, spinal stenosis, and degenerative disc disease. It's important to know, though, that research for physical therapy is still developing. Even though the profession started in the early 1900s to help war veterans and people with polio, until recently, physical therapists have had to rely on their education and experience to provide treatment to patients. It wasn't until the 1990s that the focus shifted and the American Physical Therapy Association started to advocate for more PT-focused research. And while studies like the ones we've talked about show the many potential benefits of PT, it can be difficult to study a large enough number of people to actually come up with significant results. And because physical therapy involves working with people in pain, it can also be very difficult to study the effects of therapy without harming the people who aren't getting treatment. That means we might have trouble finding a study that is specifically about the problem that we're working on. And the studies we do have might not have enough data to give definitive conclusions. Even with those limitations, the research is pointing to physical therapy as being an effective option for many people. And now, with more research being done, physical therapists are always getting more information about what treatments get the best results. And we already know PTs are experts in the healing process and how it interacts with other body systems. So we can take into account the issues each person is experiencing and apply the research in the best way possible. As for Ben, a few months of healing later, and he could still feel a lump in the area that his swelling and pain used to be. But he could walk and run without too much problem. At first, his ankle felt wobbly and sore sometimes, but he used the list of exercises his PTA recommended whenever that happened. A few months after that, he hadn't needed the exercises in a while, and had used the techniques he learned at PT to safely get back to his old running distance. He also knows if he does have issues come up, his therapist is only a phone call away. If there's a topic you'd like to know more about, please let me know in the comments. And if you found this video helpful, please share it with someone you know and let me know by hitting the like button. Thank you, and bye.